I'm a little out of my league. My fellow guest speakers here. My background is I played the game. I coached high school football for 7 years and college for 31 years. Now that makes me old. But I was a school board member in my local community for 7 years. I was on the American Football Coach Association Board of Trustees for several years. I was on the Rules Committee of the NCAA for 1.5 terms. And I have learned a lot. I've been exposed to great doctors and trainers in my career here at Michigan. But really, when it comes down to the real issues of concussion, I'm very uneducated. And so I've learned probably more since I got out of coaching. I've read all the New York Times articles on this issue. But I guess what I want to do today is give you one perspective from the standpoint of one coach. I received an award my last year in coaching, the Bobby Dodd Award. Bobby Dodd was a great player and football coach and athletic and director and Hall of Famer, the whole thing. And he wrote a book. And I was given this book as a gift back my first year in coaching in the late 60s. And Bobby Dodd, at the end of this book, he said, the one thing that we must always keep in mind is that the most important thing in the game is the boy who plays the game. And, that should be our mantra in coaching. And because it's more important than winning and in the money and in the prestige and the fame that comes with success. And I always tried to keep that in mind from the time that I read it. I had coaches who were like that, it was a different era. But I think we all understand there's a risk in sport, especially games like football and lacrosse. But it's there in soccer as well, hockey, and a lot of other sports. But and football, back in the early 1900s, Theodore Roosevelt saved the game. There were a lot of people. There were a lot of deaths in this game. And there were people that wanted to abolish it. And Roosevelt had a son who played the game, and he loved the game. And he brought a lot of coaches together, and he said, look, if you don't develop some rules, make this a safer game, then we are going to abolish it. And, of course, that is no different than what we have today. But in my lifetime, certainly, the most serious research that has come forward is this link between concussion and long-term mental health risk. This morning in the New York Times, Dr. James Bonke, I may murder his name, but he's a University of Michigan doctor. He said the level of evidence is very, very strong. A professor of biostatistics at the University of Michigan and an outside advisor on the research. He said strokes and head injuries, which make Alzheimer's more likely, also cause brain inflammation. And so this is a wake-up call. And I applaud the New York Times because I think as a group of professionals in the coaching profession, most of us are not educated like we need to be. There are, and what we need to do is, there's legislation in the Senate, the House of Representatives, regarding the safety issues. We have the NCAA. We have all of these state high school athletic associations, the NCAA, the university presidents who have taken over the leadership of intercollegiate athletics, the equipment manufacturers, the officials, the people who make the rules, the media, and parents. All of those people, we have to get on the same page. And that's a major problem. It's a major challenge. It's a major job. And but in my view, education is the key, and that's what we've heard today. But how is the game being taught? How is it being coached? What are the rules? How is it being officiated? How is it being administered? And so yesterday, the New York Times had an article about John Madden football in the NFL that was alluded to earlier. And this is really exciting stuff to me. And I think it probably can be applied to any sport. But in Madden football, which is produced by EA Sports, they will no longer show plays where they will teach that it's wrong on these video games that all of these kids watch. It's wrong to lead with the head. They're going to make that point. They will not display helmet-to-helmet hits no longer. And that's been a big part of the attraction in the past. I can give you an example. In 1997, we were playing Penn State late in the season, and the national championship was on the line. I had a player named Adrian Taylor, and the game was at Penn State, and on the Penn State sideline, Adrian Taylor made the hardest hit I've ever seen on a football field. I mean, you could hear that all over that stadium. And, of course, Adrian Taylor never played another snap of football because they felt after his recovery that he wanted to play, but they did not feel the risk was worth, and he never played again. But for the entire next week, that play was shown on ESPN, it seemed like hundreds of times. And so I think the idea of taking a game and teaching youngsters how to play safe, they're not going to show defenseless players. You know, the most dangerous play in football is when a quarterback is looking down the field to throw a pass, and he gets hit in the head from someone he doesn't see. And and the NFL has done a great job in making that a fine and directing themselves to correcting that type of play. They are going to show concussioned players in this video, but they're going to show that they have to be removed and it's no longer safe for them to return that day. So I think there's some tremendous things being done with this, even though it's a business. They're trying to make money. But if you can expect, how many kids today learn the game watching it on video as opposed to playing it themselves in the park? And what they see influences the way they play the game. Chris Collinsworth, who is a former NFL player and now a lead broadcaster on the games, has done an unbelievable job of pointing out unsafe play in NFL games. And he's taken a lot of criticism for it, but I think it's that we've got some things in the media and in the educational realm that's going to have great impact. But in the chat rooms, this is very unpopular with the changes that they're making in this game. But I think those of us who've been in the game understand It's a great issue. I think the most important thing as it relates to the game itself is how long are the games and how long are the seasons. You know, in the NFL, Dan Rooney, who is the owner and now he's the ambassador to Ireland now, but he owns the Pittsburgh Steelers, and he is one owner in the NFL who has come out opposed to lengthening their season to 18 games. Even though for him as a businessman, 18 games is a lot of money as opposed to 16. And but we have the same issue in college football. When I played, we played a 9-game season, 9 games, and I can remember we had a great year. We were invited to a bowl game. They asked the players if they wanted to go, and the team voted no. It's probably the last, I guarantee you, it's the last time a college team did not go to a bowl game because they voted not to, because there's money in those bowl games, you know. And then we went to 10 games, and then we went to 11 games. And 6 or 7 years ago, towards the end of my career, there was a proposal for a 12th game. And I was in an AFCA meeting in Louisville, Kentucky, I think maybe Texas. But at any rate, Miles Brand, the president of the NCAA, was there. And someone asked him about why there was such strong support among the presidents and the athletic directors for a 12th game. And he said, it's hypocrisy. I mean, anybody in that room was stunned to hear that. And he went on to say exactly what we knew as coaches. It was all about money. And, of course, they went on and passed that legislation, and now we have 12 games. And, of course, with a bowl game, we have 13. And in the Big Ten Conference this year, we're going to a playoff because of the additional of Nebraska to the conference. So the Big Ten champion next year will play 14 games. And the thing that a lot of people don't understand in college football, there are more plays in a college game than there are in a professional game. So at one time we did a study, we found that 12 college games was like playing 15 professional games. Now, the NCAA and I think our commissioners, they have tried to shorten the games and by letting the clock continue to run on out-of-bounds plays and some of those things. But the truth is that those are major issues as we go forward in college football. The other issue that is of great concern is the equipment issue. In the 1960s, you know, in the 50s, there were a lot of helmets without any face mask. And there's a lot of people who believe today that the face mask is what has led to taking away the fear of a player getting hit in the face. He plays without fear, because if you look at the helmets today, they call what they put across the face a cage, and because really it's like being in a cage. The helmets have changed significantly, and the thing that I think is really a critical issue that we need to educate parents is that last year, according to the paper in the Times, there were 100,000 helmets that were over 10 years of age that were being used, and most of those were by youth football players. And so we have to do some things. There's big business in reconditioning these helmets. So they take them, a high school coach will collect all of his helmets at the end of a season, send them out to a company who will repaint them. If they have to have things repaired, face masks, etc. They'll do all of that, and they continue to use them year after year because the cost of helmets today, many of them are $200. And a lot of these schools, a lot of these youth leagues can't afford it. But we have to get beyond that in some way. And I just like to end with the idea that, to me, if you're a parent, if you're a grandparent, or if you're involved with a youngster that is getting ready to play the game, the number one thing I think you need to do is make sure that he or she has a good physical examination, because there are too many instances in the past where they have not had physicals, and it has led to major issues. Conditioning is another thing. They need to run and condition, particularly for a sport like football or any sport where they're wearing a lot of equipment. They need to condition themselves before the season starts without the equipment. You know, in the old days, football players would show up the first day of practice, put all the pads on, go out and play in August. And that is an extremely unhealthy thing. I think the other thing that is critical in today's football, when I played, a guy 240 pounds was one of the biggest men on the team. And as recently as the 1980s, players were linemen, the biggest players on the team were 250, 260. My last year, I had a tackle, a great player named Jake Long, who played at 330 pounds. If you look at what has happened physiologically, players are much bigger, they're much stronger, and they're much faster. And that's why there is a greater risk at the game. But in my judgment, one of the things that any young athlete needs to do is they need to make sure there's strength training for the neck. It's something to me that it has to be a major point of emphasis as we go through. And, you know, the key for a parent is if you watch enough practice, if you listen to the coaches, it's pretty easy to really figure out who's really good and who needs to learn some things, you know. And that's something, you know, that in a practice, what I read recently was that the majority of concussions occur in practice. And, of course, in practice, you've got limited number of coaches, and when you have contact drills, it's impossible to see 22 guys. And that's why if you're a parent and your son is playing youth football, or then you need to watch as many practices as you can, and you get a feel for how the coaching, the approach the coach is taking, and the kind of drills he ran. I'll never forget when I was a freshman in college, we go out and one of the first practices of the year, we got pads on, and the coach lines us up. We're 15 yards apart, and he says, now I want you to run at each other as fast as you can, and one guy will be the ball carrier and one guy will be the tackler. I mean, we knew then this guy wasn't crazy, you know, but we did it. We did it, and that's what kids do. They do what they're coached to do. And so, you know, when you see things like that, you know, then you have to be willing to take your son out of a drill, or to make sure that the coach understands that, you know, you want to know why he's doing that. And there's a way to do that, but at times when it comes down to the health of your son or your daughter, that's a pretty important issue. And then the thing that I would do is I would always ask that kid, do you like playing? Do you want to play? Make sure he's playing because he wants to play, not because you want him to play. Or he shouldn't feel compelled to play because he feels like his dad or his mother really want him to play. Because in the end, that's an issue. And is he ready to play? You know, you go out to a practice or you go watch a team practice, how physically does he measure up in stature? And, you know, there's things that if you're paying attention as a parent, you're going to know what to do when the time comes. And so I guess we're going to take some questions here. But, you know, I think the biggest thing is from a coaching perspective, you know, the communication that you have with a parent. I had a lot of parents call me, and 90% of them would say, Coach, don't tell Jimmy I'm calling, no matter what, you know. And but you got to feel like and have the confidence that the coach wants to communicate. You know, he may not. It may not always be easy, but he's never too busy to speak with you about questions and concerns that you have. Okay. Thank you.